Hey everyone, welcome back to another OSCE. It's the first one of two this week, so we're just going to do the two this week, today and Wednesday. So that this one is a little bit different to what we've done before, and might be a little bit out of the remit of some people, but for even for myself, really, with this particular one. So, but worth exploring anyway and going through it just as a bit of a learning process. I think I recognise everybody's name on the list. I think so. We'll skim through the first bit. Hey guys, how you doing? Usual suspects are in the room, which is good. Okay, so everybody knows me, so we'll skip past that. And our plan, obviously, like I say, normally we do 3 sessions. This week we're just going to do the 2, so today and Wednesday, and we're going to cover all of these subjects in 2 days rather than the 3. This case history is a little bit longer than the other ones usually are, so will probably be around about half an hour this evening. Usual tips. I think you guys who are in the room at the moment, you've already heard these before. So the differential diagnosis book is a really good one to get, as well as the Explain Pain. And then if you're a sports therapist, sports therapy background, then the Routledge book is a good one. And I've popped a link for that, but I can only link one thing at a time, and that's the one I've popped the link on for today. Okay, so first appointment then, going through that SOAP, subjective history, objective history. So the subjective history is their story. Evening, John, how you doing? And then once we've heard their story, we then need to think about an objective assessment plan. So from the things that they've said, what do we then want to go and explore? What do we want to have a look at? Then we form an assessment, and then we create a plan. Okay, so that's what we'll be going over. And again, as always, no recipes, no right answers, only thoughts and justifications. And I think then, yeah, so this one will be amended slightly. So just 2 sessions. So we're going to introduce the case. And throughout it as well, we'll start to just drop in some of the things that we might test for. Okay, just to get you guys thinking about some things. Okay, so it's not a low back scenario. That's from the other week. Okay, so copy and pasted the wrong one. Let me just pop that over there. Okay, so this is one of our key focuses today, as always on these. Are the flags, the red flags especially. So is there anything within the scenario today that might be considered a red flag? And if not, great. Then are there any yellow flags, or are there any psychosocial aspects to the case history that we may need to consider? Okay. And as always, bits when you treat patients, some people will be more biomechanical issues, biomedical issues, some will be more social, some will be more psychological, and everybody will be a little bit of something. So if you only have one approach to the way that you deal with patients, then you're going to miss out on some of the aspects that may be affecting some other people. So we had a bit of a discussion a few weeks ago about posture and pain, and the reliability of postural analysis, especially the inclination of the pelvis. I think it was with the chat of me and Dan Lawrence did that one. And we know that the biomedical model and the biomechanical model is not as useful as we thought it was. Still useful in some respects, but doesn't give us anywhere near the answers that we thought it did. And we have to consider the social aspects and the psychological aspects of that person's lifestyle that may be contributing towards their symptoms. Okay, so pain isn't always about things being a little bit out of whack. Sometimes it's things that are going on in their life that is creating more symptoms than actual issues with their biomechanics. Okay, so everybody's got a little bit of something. So we then use the sieve, and you guys have all seen the sieve before. So we'll start to put this together. We'll do it together today, and we'll start to put this into practice, because we've only got 2 sessions. So we'll start to do that for you here. So this is our person. We have got H, I think her name's Hilda, 34-year-old receptionist who's 35 weeks pregnant. Okay, so this is why I said this might be a little bit out of the remit of some, but still worth knowing about these kind of things that are going on, because it may be that you come across someone who is pregnant down the line, and it does fall into your remit. But I think it's good just to explore it and realize the things that we didn't know. Okay, so it's evident that she's having some difficulty walking. Okay, so if you guys want to comment in the chat at all today, we'll take on some of your comments rather than saving them up. So what I guess one of the things is why might she have difficulty walking at 35 weeks pregnant? If any of the ladies that are in the room have been pregnant, then you can give us your insight into that, and also if you do treat people that are pregnant, then let us know. So it appears to you that she looks a little bit unbalanced. Well, again, what do we expect with someone who's 35 weeks pregnant? You would imagine that their whole center of gravity, center of mass will be definitely interrupted from what it would be normally. Good, Natalie. Well, you'll be one of our experts tonight then, so that'll be really useful. So there are a number of conditions that affect pregnant ladies. So obviously this is one of those things where we think about the epidemiology of these things. So with study of population. So if you study pregnant women in terms of musculoskeletal problems, what kind of problems would they normally have? And these things should be automatically coming into your mind. So her face appears a little swollen. All right, so that's a big clue as to what might be going on. She only came to this country a year ago. She's originally from France and knows very few people. So imagine being 35 weeks pregnant, away from mum, family in general, and in a foreign country. Okay, so different kind of healthcare system, different kind of lifestyle. How is that going to affect the psychological aspect of the pregnancy? Okay, so that will be some of the things that will go into my good. Well done, Natalie. That would be one of the things that would go into my psychosocial aspects. Okay, and Natalie's just mentioned their preeclampsia, so definitely one to have a look at for Wednesday. Okay, because we're going to discuss that in a bit more detail. And also her husband left her a month ago. Okay, great. So 35 weeks pregnant, and the other half has done a runner. So hands and face swelling for preeclampsia. This is out my remit, but a lot of anxiety, stress towards the end of a pregnancy. Yeah, definitely. And especially if you're in a foreign country and your other half has left you as well with a month, just over a month to go. So, hopefully you can see just within that page all of the information that you can get from someone's story. Yeah, so that's just a couple of paragraphs really of information, and you can glean so much information from it. I think what you do have to be careful of, though, is that you don't suppose things without further questioning them. Okay, so yes, definitely try and read the situation, but don't go into it in too much. Don't follow just one lead, because you tend then to forget other things. Okay. High blood pressure with stress, a phobia and new area. Yeah, definitely. Yeah, good. We'll have a look at that kind of stuff, Natalie, in more detail on Wednesday. So that's really good. So the presenting complaint what she's come in with is intermittent pain radiating from the spine of the right scapula over the right levator scapula and supraspinatus muscle to the right shoulder. She's also complaining of some discomfort at the symphysis pubis, so that's where the pubic bones join together at the front. Yeah, really good. Yeah. So Natalie just mentioned again, NHS, all things new in this country. Yeah, we will deal with pregnancy. I mean, I don't know how they deal with it in France, to be honest, but I would imagine we would deal with it very differently in this country than they do in France. She's also complaining of some discomfort at the pubic symphysis when walking, and also stiffness in her feet. Okay, so what are some of the other things that pregnant ladies often suffer from, especially during the latter stages of pregnancy? Is it to do with their feet and pubic symphysis area? So if you're not sure, don't worry, then that's something to have a look for on Wednesday. So other symptoms, she's got occipital frontal headaches, so going from the back of the head to the front, okay, and associated visual disturbance. So what kind of things might cause that? Has an awareness of a sensation of pins and needles over the supraspinatus area, and on occasion into the right hand and wrist, which is non-specific in distribution. Okay, so again, we've covered this kind of thing before. So when you have an issue with a nerve root, so from a specific level in the neck, it will usually affect a specific dermatome. So for example, the median nerve will be these fingers and a little bit of that one and a little bit of this one. Ulnar nerve, these two. Okay, so it doesn't appear to be a nerve root issue. Okay, so we could put it down on our sieve that it could be, and we could test it, but it would be down my list of things to check. Okay, and that's the thing. When they say that, and then you go, right, okay, that could be nerve root, could be median ulnar nerve, which are the ones that go down into the hand, but it's less likely because of the kind of symptoms she's getting. So what's the other thing that can cause pins and needles and tingling into the hand and the wrist area? Okay, what other issues might you have? And we've covered this a couple of times before. She's got an inability to carry weights in the right arm, as this gives a sense of coldness and numbness in the arm. Okay, so the whole arm is going numb and cold, but no pain. She has full range of motion. Yeah, so that's an interesting one, because usually if you've got a musculoskeletal issue, you've got a muscle injury, then you wouldn't be able to move the joint. Yeah, could be. Yeah, so carpal tunnel been mentioned there. Good. What do you mean by nutritional, John? Is there any specific thing that she might be lacking, or what? Yeah, dig into that a little bit deeper. That's really good. Okay, so the scapular pain started 10 months prior to presentation for no apparent reason. Okay, good, Louise. Yeah, blood supply. So what's the name of the condition that will cause numbness and coldness into the hand? B12 deficiency. Yeah, cool. Yeah, good. Subclavian artery occlusion. It's usually not there. It's usually not at the subclavian area. It's called it's a different part of the artery. It's the same blood vessel, but it's called a different part because it's a little bit further along. That was good, Namir. Well done. Yeah, so she's had this scapular pain for a while, 10 months. So obviously before the pregnancy. The headache started 2 weeks ago, and for no apparent reason. That's what NAR means. And the slightly unbalanced gait has only been present for 2 days. Okay, and I think someone mentioned, yeah, slightly movable joint with the pubis. Yeah, why is that? So why does that happen during pregnancy? Progression, gradually worse over time. The pain is there every day now. Okay. Thoracic outlet. Yeah, good. Well done, Louise. Yeah. So if you haven't seen that before, we covered it in a few OSCEs ago. So if you go to the playlist of OSCEs, there's, I think it was I think it might have been the shoulder, the very first one that we did. Yeah. So thoracic outlet issues. Cool. Okay, so aggravating factors for the neck. Okay, so Natalie's just put the body getting ready for birth, lax ligaments. Yeah, good. What makes the ligaments lax? All right, so I'll see if you can find that out. A bit of research on that. So flexion of the head and neck, sitting forwards, and general activities involving carrying weight makes her neck symptoms worse. All right, so what muscles might be involved if when you bring your head forward, it hurts down here? Look, nothing nasty, just normal musculoskeletal stuff. So what could that be? It could be, yeah. That is shortened in that position when you bring the head forward. But it may be the contraction of it that's causing the issue. Yeah, good. Traps, yeah, definitely. Yeah, that's a good one. I think we mentioned on a couple of slides ago the levator scap as well. Relaxing, yeah, good, Catherine, well done. Yeah, so you have circulating relaxing hormone in your bloodstream when you're pregnant, and it makes the ligaments more lax than usual for obvious reasons. Yeah, so we need that movability of the pelvis for delivery of the baby. Levator scap, yeah, good. Yeah, so traps, levator scap, usual kind of things. And if you think as well, she's near the end of her pregnancy, and usually you get a lot of breast enlargement at that stage of pregnancy, so you're going to carry your shoulders very differently to what you would normally do. Okay, so but maybe that's contributing as well. Worse when holding the telephone between her ear and her shoulder at work. Okay, so remember, she works as a receptionist. Yeah, so again, we've potentially got that trapezius, levator scapular kind of area on constant tension while she's at work. Good. So other history, an inability to stand for prolonged periods of time or to put direct pressure onto the soles of the feet. So I think, Natalie, I think you mentioned about swelling earlier, but what other things do pregnant ladies get, especially in the feet, soles of the feet? Okay, what other kind of conditions might she have? And it hurts to put direct pressure onto the soles of the feet. So this has been present for approximately 3 months towards that latter stage of the pregnancy. Abdominal separation, yeah, so diastases recti. You can have a separation of the six-pack muscle, the rectus abdominis, during the latter stages of pregnancy. Yeah, good. Plantar fasciitis as well. Yeah, good. Well done. Really common with pregnancy. Okay, so another thing where you think, what I'm trying to get you to do is think, right, 55-year-old man could be this. Pregnant lady, usually this. Young kid, usually this. And that there should be things that, depending on the area of the body, the age of the person, and the sex of the person, will immediately spring these conditions into your mind. So that's really good. Yeah, been present for approximately 3 months, aggravated by walking downstairs and forcing the right foot into plantar flexion. Yeah, good. Tight calf muscles, again, yeah, that could definitely be contributing. Increased pain and pubic symphysis on walking, again, might be a pubic symphysis dysfunction, which I think you mentioned earlier as well. So 35 weeks pregnant with the first baby. She understands that treatment could be beneficial to her during the pregnancy. So she's come for therapeutic treatment. Okay. She's increasingly getting heartburn and gastric reflux, and she has general swelling over the anterior aspect of both ankles and wrists. Okay. Her routine scans to date have been normal, and her general health is very good. All right. Now, this is a big clue. And I think, Natalie, you mentioned the problem here before. So the midwife has said that there was something wrong with her urine on her last checkup a week ago. So what kind of things do they check all the way through pregnancy, and especially if the face is starting to swell and the hands and the feet are starting to swell? Okay. And I think, Natalie, you did mention it earlier. So past history, there's a history of episodic recurrent neck pain. So she's been having the neck pain for a while. usually occupational related or induced, which is kind of normal, isn't it? For someone who works at a desk all day, using the telephone kind of scrunched up to their ear, you would expect that kind of postural tension while she's at work, and especially if she's not moving around so much. Neck starts out generally stiff and then aches in the areas mentioned, so around that right shoulder. Symptoms go with rest, and she's had it for 10 months. Each episode is gradually getting a bit worse than the one before. Well, that could be because of the progression of her pregnancy. Okay, so as she's getting a bit more heavy on the front, starting to change her posture at work, and will increase the postural tension in the muscles on the back. Okay, so we definitely need to have a look at her when she's seated at work, and what kind of position that she's in for long periods of time. Now, posture on its own is not so bad. Okay, so slouching is not bad for you, but if you're doing it for 8 hours a day, it will become very fatiguing. So those muscles that are holding you in that position will get tired and achy, and that's the whole point. So the posture in itself isn't bad, but it's the length of time that you hold it for. Okay. Really good, Catherine. Yeah. So mention gestational diabetes. See, that's another thing. When pregnancy comes into your mind, or someone is pregnant that comes in, that's another condition that you should immediately be thinking of. Yeah. So that's really good. Well done. So this episode has been the first time the arm has gone cold and numb when holding weights. Okay, so basically holding things in front of her. So and you mentioned the thoracic outlet before, which is good. Just out of interest, do you remember the test for thoracic outlet? Okay, so those of you that have done this a few times already, do you remember? Well, there were a few tests, but do you remember any of the tests for thoracic outlet syndrome? Okay. Past medical history: general ear, nose, and throat and sinus problems since childhood. Okay. And she had a tonsillectomy when she was 15. Yeah, good, Namir. Well done. So you got Adson's test. So we can have a look at that again on Wednesday. Yeah, so we'll have a look at that one. For thoracic outlet. Thank you. Are there any others? Okay, so see if you know any others as well. Social history: mother alive and well. She's got one sister. Recently, her husband left her, which we found out, which has obviously caused her a great deal of stress. It depends on what he's like, whether he's useful or not. And then cardiovascular wise, Hilda is seeing her midwife regularly, and she thinks that her BP has been a little bit high. Okay, so we've got a bit of an alarm there going off. Okay, nothing to worry about is what she thinks the nurse said. Okay, so if you were allowed to see this patient, if it was within your remit, one thing I would definitely do here, if she has mentioned that her blood pressure is high, is do her blood pressure. Yeah, I'd want to know for sure exactly. BP is blood pressure, Peter. Sorry, yeah. So if her blood pressure is high, then that again is pointing towards some kind of preeclampsia, something like that. Okay, so we've got a few things pointing in that direction. Ruse test, yeah, good. The old ruse test like that, yeah, good, very good. That's a good one. We'll talk about that on Wednesday too. Yeah, that's good. If you've not seen it before, go. If you go to the Physio Tutors page or the Physio channel, I'm not sure whether Dan's done a video on it, but have a look for ruse test. So, what is normal blood pressure? So we've got a systolic figure and a diastolic figure. So the higher figure is the pressure on the arterial walls. Not her root test. Oh, good. Yeah, and Wright's test. Yeah, very good. Well done, Namir. So yeah, the higher figure is the pressure on the arterial walls when the heart is beating, and then the lower figure is the pressure on the arterial walls when the heart is at rest. Okay, so we've got the pressure wave and then the rest. So the systole and the diastole. Okay, so systolic and diastolic blood pressure. What is it normally, or what should it be? Okay, let's see if you know that. Cool. Family history. Maternal grandmother, unfortunately, has passed away. History of cardiovascular complications to family as a whole. Her father died at age 54 of an MI, which is a myocardial infarction. It's a posh word for a heart attack. Her sister has Wolff-Parkinson-White Syndrome. Oh, that's a good one. So I've had 2 patients with this before. And one when I was a student, actually, as a student osteopath. So if you've never heard of it before, have a look at it and look it up for Wednesday. Okay, we'll have a look at that as well. Medication, she's on antacids when required. Ear, nose and throat. She's got a long history of sinus and throat problems, but she has had that tonsillectomy when she was 15. All other review of the systems is negative, except for increased heartburn and gastric reflux associated with the pregnancy. Okay. Any takers on the normal blood pressure? Any idea what the figure should be? What over what? Okay, I'll give you a little bit more time for that one. Cool. So it's a fairly comprehensive case history, that one. And there are a lot of stuff going on, a lot of things it could possibly be, but you guys were coming up with things all the time. So what we now need to do is work out, well, should we treat this person or should we not? Yeah, so if we're thinking preeclampsia, can you remind the website for the drugs check? Yeah, so the drugs checks, if you're checking on medication, it's an app and it's called the BNF. Let me just pop that in the chat box. British National Formulary. Okay, so BNF. If you search for BNF on the App Store, then it should you should find it there. Yeah. Okay. Cool. Thanks, John. So yeah, normal blood pressure should be about 120/80. 140/90 would be considered kind of first stage hypertensive, but for pregnancy, that should be referred to the GP straight away if it's 140/90. Okay, so that's really good. Yeah, other way around, Louise. So 120/80 it should be. So your systole, which is the pressure on the arterial walls when the heart is pumping. So that's when the blood is being pushed out. That should be 120. And then when it's at rest, so the time period in between the contractions, it was at 80. Well, that was a good guess, Louise. Well done. That was good. Just got the numbers the wrong way around. So yeah, 120/80 is normal. And if it's 140/90 for a pregnancy, then you need to refer them to the GP. Okay, yeah, cool, no worries. That's what we're here for. Good. Okay, so really good chatting over the chat room as well. So that's your case history. So you got a few things to have a look at. We've got preeclampsia to have a look at. You need to look at that. You need to have a look at the tests for yeah, exactly. You need to have a look at the test for thoracic outlet syndrome. And what else did we talk about? Oh yeah, have a look for a test as well for plantar fasciopathy, okay, or plantar fasciitis. So if you want to have a look for that too. And what else was in there? I think that was probably it. That will keep. Oh yeah, Wolff-Parkinson-White as well. Yeah, so have a look at for Wolff-Parkinson-White syndrome. See what you can find out about that. Okay, so good session today. Just coming up to half an hour now, so we'll close that one there. If you've got any thoughts or anything like that you want to, any comments you want to make on the Facebook page, then please do that. And what was it for TOS? So we've got Ruse, Wright's test, and Adson's test. Okay, so those three, you can have a look at those. Wish this yeah, it's yeah, thanks, John. Yeah, it's mad, isn't it, how things change. I wish this was around when I was studying. Would have been very good. Cool. So yeah, so me and Dan are on tonight at 8 o'clock. Yeah, we're back, Natalie, at 8. And we're talking about FAI, which is femoroacetabular impingement. So impingement of the hip joint. Okay, so yeah, Dan and I are going to be back at 8 o'clock today if you want to have a look at that as well. The clinical chat link is on the MTE CPD Facebook page as an event, so you can sign up on there if you haven't done that already. Okay, cool. Thanks for joining me tonight, guys, and I will see you Wednesday at 6. Thank you.